Hi, my name is Ashley Wick and I'm doing my daily patient reassessment video. So before entering the room, I'm going to check the patient's EHR for any new lab values, any new orders from the physician, or any allergies, and then I'm also going to check the outside of the room for any flags or markers which could indicate a fall risk or allergies, and then look at any precautions that I should take and wear any PPE as necessary. Okay, and I don't see any of those, so I'm going to knock on the door. Knock, knock.
Come in.
Okay, and I'm going to provide my patient with privacy. Hi, my name's Ashley. I'm going to be your nurse today. Can I grab your name and date of birth?
Tara Elias, 2/14/2005.
Awesome, and that matches her EHR as well as her wristband. So, Tara, what brings you in today?
I have a migraine.
Oh, okay. When did that pain start?
About 2 weeks ago.
Okay. Can you describe that pain for me?
It's like achy pain.
Yeah. Where's that pain located?
On my lower back of my head.
Okay. What makes that pain feel better?
Resting,
Okay. What makes that pain feel worse?
running, and moving around.
Yeah. Okay. And then, can you rate that pain on the scale from 0 to 10?
I would say a 7.
Okay, that's pretty high, but we're gonna try and get that back down for you. So now I'm gonna take some vitals from you. Okay, I'm gonna use this temporal thermometer. I'm just gonna run that across your forehead. Okay, 98.2, and that's within normal limits. Perfect. Okay, now I'm gonna listen to your heart for 1 full minute. Okay, is it okay if I pull this down? Perfect. Okay. Awesome. So your heart rate is 81 beats per minute, and then your respirations are 16 and relaxed and unlabored. Perfect. So now I'm going to take your blood pressure. I'm going to measure this cuff on your arm. Okay. Awesome. Perfect. Okay. Okay, and then I'm going to start off by estimating your systolic blood pressure. So I'm going to locate your brachial artery. Okay, I estimated about 130, so we're just gonna go 30 above that. about 126/82. So that's within normal range. Awesome. Okay. Now I'm just going to take your pulse oximetry. So I'm going to put this on your pointer finger. Perfect. And then you can just rest your hand. Okay. It's 98%, which is in normal limits. Okay. So I'm going to move on to the neurological assessment. So my patient appears alert and conscious and aware of stimuli, but I'm going to test her orientation now. So can you tell me where we are right now?
The hospital.
Okay, and who am I?
Ashley.
Awesome, and who are you?
Tara.
Perfect. Do you know the date today?
April 16th.
Perfect. So my patient is aware of time, person, and place. Can you smile for me? Awesome. So my patient has no facial droop. Perfect. Okay, and if my patient was not oriented, I would perform a Glasgow Coma scale just to measure her level of consciousness. Now I'm going to measure her pupils. Okay, about 4 millimeters, which is perfect. And I'm going to test her reactivity to light. Awesome. So pupils are round equally and also equally reactive to light. Okay. Perfect. And my patient responds to my questions, and she has a relaxed body position. Her facial expression is relaxed as well. She has good hygiene, no odor. Okay, and then can I expose your skin quick? Perfect. And the skin appears intact with no obvious lesions. Perfect. And the color is consistent with her genetic background. So now I'm going to test your muscle strength. So if you could just push against my hands. Awesome. And then pull towards yourself. Good. Okay. Push against my hands. Awesome. Pull towards yourself. Great. And then can you lift your right leg up off the bed? Okay. Now your left leg. Awesome. My patient muscle strength is about a 5, and she has full range of motion. Now can you wiggle your fingers for me? Perfect. Wiggle your toes for me. Awesome. Have you experienced any numbness or tingling in your fingers or toes?
No.
Okay, perfect. Okay, so now I'm going to move on to the respiratory section of this. So if my patient had a nasal cannula or an oxygen mask, I would check the oxygen flow rate and make sure that they were fitted properly, and if they weren't, then we would try something new. Okay, and then have you experienced a cough recently?
No.
Okay, perfect. And if my patient did have a cough, I would ask her about the characteristic and quality of that cough, as well as if there was any mucus. I would ask for the amount, color, and consistency of that mucus. Do you use an incentive spirometer?
No.
Okay, perfect. If my physician ordered for my patient to use an incentive spirometer, I would teach her how to use that, teach her how to use like deep breathing exercises, and that's just gonna help her like open her lungs and take those deep breaths. And she would do that about 10 times every hour as well. Okay, now I'm going to listen to your lungs. So if you could sit up for me. Perfect. Okay. And then just take regular breaths for me. Awesome, those all sound good. And I'm just gonna listen on your back as well. Awesome, so breath sounds are clear and I don't hear any adventitious sounds, so those sound great. Perfect. Now I'm gonna move on to cardiovascular system. So first I'm gonna listen to your heart sounds. So if you could lay back down for me. Okay. And then I'm gonna listen to aortic, pulmonic, Erb's point, tricuspid, and then mitral is gonna be down there. And then first I'm listening with the diaphragm of the stethoscope. So aortic, pulmonic, perfect. And then could you just unzip that a little bit for me? Okay, Erb's point. Great. Tricuspid. And then mitral over here. Awesome, those all sound normal and I don't hear any extra heart sounds, but we are gonna listen with the bell as well. Okay, we're just gonna repeat it. So aortic, pulmonic, Erb's point, tricuspid, okay, and then mitral. Awesome, and those all sound great, and I don't hear any extra sounds in there. I heard S1 best at the apex of the heart, and then I heard S2 best at the base of the heart. Okay, now I'm gonna check capillary refill. Okay. Awesome, less than 3 seconds, and I'll check on her feet as well. Okay, less than 3 seconds. And then while I'm down here, I'm also gonna check for any edema in the feet, ankles, or her legs. So. Okay, and then I don't know any edema or pitting in her legs, so that is good. And then I'm gonna palpate her dorsalis pedis pulses in the feet. Okay, I would give those pulses about a 2+. I can feel them, and they're equal bilaterally as well. So now I'm gonna palpate the posterior tibialis pulse, which is just behind right here. Okay, I'd give those about a 2+ as well. Those are equal bilaterally. Awesome. And then I'm gonna find her radial pulses as well. And I feel those equal bilaterally as well. So those are also a 2+. Other things I just want to make note of, if she had an IV, I would just like to check the fluid type in that IV, and then where that site is. I just want to check if there's any like redness or irritation surrounding the IV? And then also, do you wear any like SCDs or TED hose to prevent deep vein thrombosis? Okay, and then if she did have those, or if a physician prescribed those for her, I would just like teach her how to wear them, make sure that those were available to her, and they do just kind of help your circulation. So yes, okay, now I'm gonna move on to skin. So while assessing her skin throughout this whole assessment, I've definitely noticed that there are no obvious lesions noticed. Her skin is intact. There's no excess moisture or dryness. Her skin is smooth. I'm just gonna feel the temperature. Awesome. Her arms feel warm. And her legs are warm as well. So her body temp feels warm as well. So, and then we would also want to perform a Braden scale, which assesses her risk of skin breakdown, but she would score a 15 on that just because her skin is intact, in good condition. And then we're also going to test for her skin turgor. So we're just going to grab that skin around the clavicle. And her skin retracts very quickly, so my patient is definitely hydrated. And then I would also ask, do you use a specialized like air bed or anything like that? Okay. If my patient did use like a specialized airflow bed or anything like that, I would definitely make sure that it was being used correctly, that it was on, and I would also make sure that the patient's bed is below 30 degrees, as that will help prevent skin breakdown and help prevent pressure sores as well. And if my patient was at risk for developing pressure sores, I would just make sure to implement a turning schedule so that we could reduce or prevent pressure sores for her. Okay, so now I'm going to move on to the abdomen. So first, just looking at her abdomen, it's flat. I don't notice any like distension in her abdomen. I also don't notice any obvious lesions or dressings or tubings. If there was like ostomies or anything like that, I would just make sure to provide care as needed, and then assess any breakdown or irritation on her skin. So now I'm just going to listen to your bowel sounds starting in the lower right quadrant. Okay. Do you mind if I just pull this down? Perfect. Is that comfortable? Mm-hmm. Okay. Awesome. So bowel sounds are present in all 4 of those quadrants, which is good. So now I am going to palpate your abdomen, and then just let me know if at any point you feel like any discomfort or pain in your abdomen.
Okay.
And I'm just performing light palpation. Awesome. Did you feel any pain during that?
No.
Okay, good. I didn't notice any distension or firmness in her abdomen, and no tenderness as well. Are you tolerating your diet?
Mm-hmm.
Okay. And what does your diet like consist of?
I try to eat pretty healthy, like salads. I eat lots of food that's rich in fiber and proteins.
Okay, that sounds great. I don't see any need to change your diet at all. That all sounds great. Do you pass bowels frequently?
Yeah.
Okay. Would you say you have any trouble passing bowels?
No.
Okay. And when was your last bowel movement?
Yesterday.
Okay, perfect. And then can you just rate your bowel movements on this Bristol stool scale?
I would say a 4.
Yeah, okay, that's great. That's kind of typically what we look for. So that's great. Okay, now I think I'm gonna move on to the urinary section. So do you void frequently?
No.
Okay, perfect. And then how much would you say that you usually urinate each time? I know it's hard to tell.
About a cup.
Okay,
So.
yeah, awesome. And then what color is your urine usually?
Clear or very light yellow.
Yeah, is it cloudy at all?
No.
Okay, and do you ever like notice a foul odor coming from your urine?
I don't think so, no.
Okay, and then is there any like itching or burning sensation while you urinate?
No.
Okay, awesome. So that would just rule out an infection in the urinary tract. So my patient does not have a UTI, I would say. And then if my patient had a catheter, I would just make sure to check the skin around that catheter, make sure that it's intact, and then also check the patency of that catheter as well. Okay, I would also, if my patient had urinary retention, I would make sure to perform a bladder scan, and then we would go from there, see if she would need a Foley catheter or anything of those sorts. Do you tolerate activity and mobility well?
Yeah.
Okay. Would you say you need any like mobility aids or assistance?
No.
Perfect. If my patient did need any like assistance or mobility aids, I would just make sure that those were available to her and that she knew how to use those as well. And then I would also complete a Morse scale to assess my patient for a fall risk. So that would just test like her level of consciousness, if she's had any previous falls. And are you on any medications?
No.
Okay, and some medications can actually affect your level of consciousness, putting you at a higher risk for a fall. Some of those include medications such as like opioids. Okay, so I think that pretty much sums up my assessment. Do you have any questions for me?
No.
Okay, and then before I head out, is your bed position okay?
Mm-hmm.
Perfect. And then, do you need any like food or water? Can I bring you anything?
No.
Perfect. Can I take you to the bathroom at all? Awesome. And then, how's your pain right now?
About a 5.
Okay, good. And then we can look into getting you some pain meds too, just to help you feel better. So before I leave, just gonna make sure that the bed is locked. It's in the lowest position. Her call light is in reach, and then these 2 side rails, or like side bed rails, would be up as well. Okay, well, is there anything else I can grab you today?
No.
Awesome. Well, thank you so much for cooperating with me.
Thank you.
Awesome. Now perform hand hygiene and exit the room. Thank you.